Well, welcome everybody. It's great to be here at Newcombe Public School, and I want to thank the Principal, Matt Lewis, for hosting us here today as we announce our back-to-school plan for students right across New South Wales. This morning I'm joined by the Education Minister, Sarah Mitchell, our Public Health Officer, Dr. Kerry Chant, Professor Kristine McInerney, who's the Director of the National Centre for Immunisation Research and Surveillance, as well as Geoff Newcombe, the CEO of the Association of Independent Schools, and Dallas McInerney, the CEO of Catholic Schools New South Wales, as well as Georgina Harrison, the Secretary of the Department of Education here in our state. So can I begin by saying it is incredibly important, and we've been working day and night to ensure that we get kids back in the classroom in a safe way on day one, term one. We all know that kids do better at school, not just from an educational perspective, but from a mental health and social outcome perspective. It is where our kids learn the best and where opportunity is created. Importantly, we want our kids back in the classroom in a safe way. And that's exactly the plan that we've worked together with New South Wales Health, with the Department of Education, to ensure we have that outcome. As a parent, I know that many parents across the state are anxious about bringing kids back to school. Importantly though, we can assure parents and teachers right across New South Wales that we can do so in a safe way. Part of that plan today involves providing rapid antigen tests for primary and secondary students and for teachers right across our state. We are currently distributing to over 3,000 schools across New South Wales, and as well all our early childhood education and childcare centres as well. We'll be providing rapid antigen tests for teachers in those early childhood and childcare settings, and then in both primary and secondary school, 2 rapid antigen tests per student per week, and in addition to that for teachers as well. In addition, we'll also be providing in similar settings to last year in relation to mask wearing for teachers and for students. Students mandated in secondary school, highly recommended for students year 3 and above. We'll obviously be having some of the same provisions such as class cohorting, in addition to that limiting visits to the school, and also ensuring COVID-safe plans for excursions and music and the like. A lot of these areas we put in place last year, but we want to ensure here in New South Wales that closing schools is the last resort, and we are incredibly confident. Now, whilst there will be disruption as we move through this period of time, and we know that as we move through this wave of the latest outbreak of COVID, that there'll be challenges that come our way. But importantly, we need to make sure we have kids back in the classroom in a safe way. And I think the work that has occurred right here in our state with the Department of Education, it's been a significant effort, not just the acquisition of these rapid antigen tests, but also the distribution of those tests as we move through. And that will ensure that we have kids back in the classroom day one, term one, in a safe environment. And I know, as I said earlier, that many parents are anxious, but ultimately, we know that kids do better in the classroom. We've had some students in our state who have already missed a quarter of their schooling. It's best for educational outcomes, it's best for mental health, and it's best for social outcomes as well. Particularly want to thank Premier Dan Andrews in Victoria and the Victorian Government for the close collaboration we've had here between New South Wales and Victoria. At very similar stages in this pandemic, we've shared information, we've collaborated in ways, we've learnt from each other in ensuring that we can do this in a COVID-safe way. The final point I'll make is in relation to boosters. Before Sarah Mitchell will also provide some further information in relation to the back-to-school plan. We still have significant capacity in our 40 hubs across the state to get people boosted. So far, we're doing around 10,000 a day, and we have the capacity to do around 250,000 a week. As we move that period of time forward, from 4 months to 3 months since your second dose vaccination, we now have substantial capacity for people right across our state to go out and get boosted. So if you haven't made an appointment with your GP or your pharmacist, please make an appointment in one of our hubs. The New South Wales Government and our health teams are here to support the federal rollout through GPs and pharmacists of that booster shot, but it's incredibly important in keeping you, your friends and your family safe. We look across the last 2 years, look what has been our success here in our state. When it's come to our COVID response, it's been the effort that people have made day in, day out to go and get vaccinated, to take that booster shot. So a clear message today is we have to keep that effort up. We have to keep that booster program moving. And I want to thank everybody for the efforts, the sacrifices they've made over the last 2 years as we move through 2022. There are already pleasing signs in front of us, but we need to continue that effort and those sacrifices, and that will ensure that we keep people safe, as I said, pharmacists, GP, or any of our 40 hubs right across the board. I'm now going to pass it to Dr. Kerry Chant, who will provide a public health update, and then the other speakers will speak in relation to education, but Sarah Mitchell will give an update, and then Dr. Kristine. Thanks very much.
Thanks, Premier. So the update is that we've had 20,324 positive test results returned, including 6,704 rapid antigen tests and 13,620 positive PCR tests. The 13,620 positive PCR results were returned from 76,672 PCR tests. We've got 2,712 people in hospital, including 189 people in ICU, of whom 72 are ventilated. We are announcing the deaths of 34 individuals today, 26 men and 8 women, and can I express my condolences to their families for their loss. Of the 34 people who died, 1 person was aged in their 40s, 5 people were aged in their 50s, 5 people were aged in their 60s, 9 people were aged in their 70s, 10 people were aged in their 80s, and 4 people were aged in their 90s. 2 people had received 3 doses of the COVID-19 vaccine, 23 had received 2 doses, and 3 people had received 1 dose, and 6 people were not vaccinated. Of the 8 people who died aged under 65 years, 6 were men and 2 were women, and 4 of these people had received 2 doses of the vaccine, 1 person had received 1 dose, and 3 were not vaccinated, and 7 of these individuals had serious underlying health conditions. Again, emphasising the important role that boosters have in protecting individuals, particularly those that are at severe risk of severe outcomes, including those over 65 and those with underlying medical conditions. Can I echo the Premier's comments about the importance of schooling for children's health, well-being and development? And I share the Premier's support for children engaging in face-to-face learning. Whilst the community cases are high, we will expect to see that schools mirror what is occurring in the community. We will expect to see cases amongst children and staff attending schools. The twice-weekly testing regime that the Premier has spoken about will allow us to pick up those cases a little earlier through that rapid antigen testing. But in addition, we're calling upon all parents to ensure that any children with symptoms are not sent to school. So please do not send your child to school if they have symptoms. Instead, get them tested, and even if they've got a negative test on that first day, please keep them home and do a repeat test, and only send them back if there's an alternate diagnosis. So for instance, if they've got hay fever and you're clear that that's the cause. In terms of we are likely to see some transmission in schools, but the strategies that have been put in place by education in conjunction with health are strong. I'll leave Minister Mitchell to discuss those strategies, but there's a range of protections that many parents will be familiar with. Some of the similarities to what were put in place in previous years, and those strategies aim to reduce and minimise the spread of COVID in our schools. However, we are expecting that with the return of schools and with a bit more mobility, that we might see an uptick in case numbers. But offsetting that, we're getting the booster doses into individuals. I do ask that parents in that first 4 weeks try and minimise their children's activities or connections with other children in sleepovers and other activities that might drive infection, so that we can preserve that face-to-face time at school whilst that community level of transmission is high. Also, if, and Professor McCartney will talk to this later, but certainly children with significant underlying health conditions, we ask you to talk to your doctor about the timing of your vaccinations and your plans for return to school. Thank you.
Well, good morning, everybody. Obviously today we're very happy to be able to share with our students and families what the return to school will look like for 2022. And as the Premier has said many times, as have I, it's all about getting our students back on day one, term one, because we know how important it is for them, not just for their education, but obviously also for their mental health, their wellbeing and the social aspects of school that Dr. Chant just spoke about. So we're ready for a COVID-smart start to 2022, and there's a range of measures that we'll have in place to ensure that our parents and our students will feel confident from day one, term one. As the Premier said, a key part of our return to school this year, which is a little different to what we've had before, is the use of rapid antigen tests. So we are distributing those kits out to school communities as we speak. We have had more than 4 million go out already. More than 6 million will be out by Tuesday evening in preparation for the return to school for students on the 1st of February. So for parents, your school will be in contact with you as to how you can pick those kits up before school returns. Many of our schools have good practices in place already to get things out to parents. We learnt very well during the learning from home period how to get things like devices and workbooks and packs out. So expect to get that advice from your principals imminently in terms of where you can pick up your kits for the beginning of school. We're asking all of our students and staff to test before they come back to school for that first day, and then of course to do those twice weekly surveillance tests for the first 4 weeks of term. In terms of those tests, what happens is obviously if you're testing negative, that's great, come to school. If you happen to get a positive test, obviously you need to let your principal know that you've tested positive to COVID. You also need to let New South Wales Health know through the Service New South Wales app how you would report any other positive rapid antigen test result, and of course follow the health advice in terms of your isolation. We will no longer be closing schools when there is a positive COVID case in that school community, and we won't be conducting contact tracing anymore. We're really moving schools in line with what we see in community settings, but parents and carers and family members will be notified if there is COVID in your school community, so again that you can monitor for symptoms in your children and make sure you're using those rapid antigen tests that we've provided twice a week. This is really about minimising the disruption to our school communities, and I think rapid antigen tests will be a key part of that. So for our students who are home because they have COVID or they might be a household contact, we will of course have a lot of material available to support you learning from home for that week if you need to. I guess for our students, the message is if you are unwell with COVID, please rest, please take care of yourself. You probably won't often hear an Education Minister say, don't worry about school, but for those few days, if you're not feeling the best, please take care of yourself and we'll welcome you back to school when you're well again. But if you're home as a close contact, there will obviously be support provided through our Learning from Home hub. There is really extensive work that's gone on over the summer break to make sure that we've got literally subject area advice year by year, so there will be plenty of support available for families who find themselves in that household contact situation. What will school look like for term one? Well, as the Premier said, there'll be a lot of measures in place that our school communities are familiar with. Mask wearing settings will continue for all of our staff and also high school students indoors. We will recommend that our primary school students wear masks as well. And again, we've distributed more than 8 million surgical masks out to schools for this purpose. Maximising ventilation continues, cohorting and limiting that mixing and mingling. Our staff, of course, remain vaccinated. Many activities will be able to go ahead, so things like music, sport, assemblies, excursions and camps. Again, in a COVID-smart way, it will be based on appropriate risk settings, parental consent and some of the measures, again, that our school communities and families are familiar with. For family members who might have a child starting school for the first year, happy to say that you will be able to come on site for that first day of kindergarten. We will allow up to 2 parents or family members on site for that, which is really important. It's a significant day in your child's life and we want to make that as normal as possible for you. Can I also now just mention the early childhood education sector? Obviously, it's been a really challenging time for our staff and educators who have been open throughout this Christmas period. And firstly, I just want to say thank you to all of them for what they're doing to keep those services open. They are just critical for our families, particularly when it comes to keeping people at work, but also for early childhood development. We can never ever underestimate how important those early learning years are. So we will be providing rapid antigen testing kits for our staff in early childhood services to also test twice a week for that surveillance. It's about keeping those centres open for our families and our children. Lastly, I just want to thank everybody who's been involved in the massive logistical effort that we've had so far to get these rapid antigen testing kits out. Obviously, we're providing them across the sectors, and I do want to thank and acknowledge Dallas and Geoff, who are here from the Catholic and Independent schools, for working so closely with us. But we're talking about more than 3,000 schools, more than 5,500 early childhood centres. This has been a military-like operation, and it's taken an army to get it up and running and underway for our school and education communities. So I do just want to thank a few of the people who've been involved. Lynn Fox, Coastal Transport, Australia Post, Position Promo, Wink and COS, and also Roberts Cohen, Richard Crooks, who've been able to provide some forklift drivers to help with warehouse operations, and of course all our education staff. Many of them have been taking extra shifts to work around the clock at our warehouse to get these supplies out. We're very grateful for your support, and we're all really excited. You know, the 2022 school year, we have everything prepared and ready to go. It's important that we minimise the disruption. It's important that our students are at school, and I'm really confident with the plans that we have in place to help achieve that.
Thank you very much for the opportunity to share some of the latest information with you today on what COVID-19 looks like in children, on the vaccines for children and adults, and also about COVID in schools. As a paediatrician, an infectious disease specialist and vaccine researcher, it's really important to say that after 2 years now, almost to the day into this pandemic, all of our staff, particularly here in New South Wales, across the country, have incredible experience and knowledge and understanding of COVID. We know in children that COVID is usually milder than in adults. If your child is infected with COVID, you could expect that they'll either have no symptoms, you may not actually know, or they will have mild symptoms with a blocked nose, fever, maybe a little cough, and that will resolve completely with a few days of extra care, fluids, rest, Panadol. We have been studying COVID closely in New South Wales, and you've seen a report from last year from our researchers at the Sydney Children's Hospital Network and the National Centre, where we examined more than 17,500 cases. Amongst those cases, only around 3 out of every 100 children required hospitalisation, and 2/3 of those hospitalisations were actually because parents were infected with COVID and weren't able to look after their children at home. Now, it's wonderful to say that that situation has actually changed considerably. We've seen parents now take up their COVID vaccines, and we're seeing fewer hospitalisations of that nature across the state right now. That, coupled with the fact that Omicron, of course, is less likely to cause hospitalisation by about 50%, and that we also now have vaccines available for children 5 to 11 years, puts us in a very good place to start the new year with children back at school, as we've heard today. On the flip side, children can get serious illness, and this is very much why we wish to use vaccines and all the measures that you've heard about today. Those serious complications are rare, but they can see children hospitalised, and risk factors for hospitalisation do include having a medical condition, being very young, or indeed being unvaccinated as a teenager or older child. So we emphasise again the important role of vaccines in preventing acute COVID and then other complex post-COVID complications like an inflammatory syndrome, which we will see more of if we don't go ahead and take up vaccines that are on offer. So if I can talk to you a little bit about the vaccines, we now have so much experience with both the effectiveness and the safety of vaccines, including in 5 to 11-year-old children. In countries like the US, more than 10 million doses of vaccines in this age group have been distributed, and safety is really coming through as a very strong and expected feature of the vaccine program that we knew when we were reviewing the clinical trial data on these vaccines. We will see a few children reporting side effects, and we've seen that in our active monitoring system called AusVac Safety, where parents or their children can respond and tell us about their symptoms. We're seeing a relatively low rate of those side effects from vaccination, and they only last a day or so. So really, the vaccines continue to be effective in preventing Omicron, and I think that's a key message, so that parents can feel confident getting that first dose in before school for their child, that can assist in preventing Omicron. Having the second dose, which is scheduled for most children around 8 weeks later, is important to get. I mentioned the interval between the children's vaccines. That is routinely now 8 weeks, and we expect a strong response to the second vaccine with that interval. But some children, the interval, it might be suitable to have that interval shortened to as little as 3 weeks. That's particularly in children with complex medical needs. And as Dr. Chant emphasised, for parents of children with complex medical needs, I'd strongly suggest to them that they do check in with their healthcare provider around both the vaccines and their return to school plan. Finally, on the vaccines, I'd like to just re-emphasise the importance of the booster dose. We know that the Omicron variant can partially evade the immune protection that we see with 2 doses. 2 doses are still protective, but a booster is best, and the interval is now shortened to 3 months. So as we've heard, there's bookings available for boosters, and this is a really important part of having kids return to school safely, is actually having parents boosted, having family members boosted, having education staff boosted as they return to school. Lastly, on tracking COVID-19 in schools, it's been our pleasure at the National Centre for Immunisation Research and Surveillance to work closely with the New South Wales Departments of Health and Education ever since March 2020, and we've been issuing a series of reports on what COVID-19 spread looks like in schools. We have another one of those reports out very soon on term 4 last year, and in that report we were able to look at what happened when an individual with a case of COVID from the Delta strain came to school as compared with an individual with a case of Omicron came to school. And at that individual spread level, we saw the rate of spread to be low and the same when we were comparing Delta and Omicron. Now that's very interesting to us. What it tells me and our team is that the measures that were employed in schools last year were very effective. They really, really do work, all of the measures that we've heard about today. But as Dr. Chant has emphasised, COVID levels in the community will track along with what we see in schools, or what we see in schools rather will track along with what we see in the community. So the whole community has a role to play by doing all the right thing in the wider community, being boosted following COVID-safe practices to keep COVID levels low in schools. If we see multiple cases of COVID coming into school, we will, see some secondary transmission. But again, like we see for other diseases, with influenza, for example, we see a lot of spread in schools. I expect, and I think we'll actually see less influenza spread in schools with all of the safe practices that have been articulated under the plan. We have many wonderful opportunities now to prevent COVID, but simultaneously be able to return children to face-to-face learning, which, as we've heard today, and as a paediatrician, parent and someone who's worked closely with educators, I can't emphasise enough how exciting it is to hear about children starting the school year vaccinated and in a COVID-safe way. So thank you very much.
Premier, Minister, there's no doubt that there's going to be some challenges and some difficulties during term 1 this year, particularly probably in the first 3 to 4 weeks of the term. But despite that, there is the strongest support for students to return to school, as the Minister said, day 1, term 1. The plan that both the Minister and the Premier announced this morning really reflects the extensive consultations and discussions that have been going on amongst the 3 sectors over the past several weeks. And I know Dallas would support me in acknowledging the outstanding leadership of the Secretary of the Department of Education, Georgina Harrison. She's done a superb job in pulling this all together. Premier, one of the very encouraging things about the plan and the approach that both Health and the government has taken is to show the confidence they have in school principals. School principals will have that responsibility. They know their school communities, and they'll need to determine the sorts of activities that will go on in their schools within that first term. And that determination will be based on consultation with teachers and with parents. Different people will certainly have different risk appetites. And the principals will have to run a risk assessment process, and I'm really hopeful that that risk assessment process will include the importance of consistency across the three sectors, at least during term one. So our approach is probably no different to what you've heard from us before. Our aim very much is first to keep our children at school, to keep them safe, to keep the teachers safe, and to do our part to keep the broader community safe. Thank you.
Good morning, everybody. Thank you, Premier. Thank you, Minister. We had two objectives in the Catholic sector. One was to guarantee continuity of learning as best we could and safe learning environments for our staff and students. With the experience of the last 2 years and the framework announced by the government today, we think we have met those two objectives to the extent that we are looking forward to welcoming staff and students back for term one from the scheduled start for 2022 school year. With the experience of the last 2 years, this framework, I think parents can be very confident that every measure that's been put in place has their students' interests at heart, and as we say, that learning journey, which is so important on a number of levels, can continue as best it can given the external circumstances. Thanks very much.
Questions?
Yep.
Ash.
Are we used to these plans being called COVID-safe plans? You call them a COVID-smart plan. Is that an admission that it's not going to be safe?
Well, we're completely focused. The entire plan is focused on ensuring that kids and teachers can get back to school day one, term one, in a COVID-safe way. We've planned for it, we've prepared for it, we've resourced it, and now we have school ready to go for the first day of term. Just like the others, this has been a collaboration across health, education, the three sectors of government, and we want to make sure, as we have done through this plan, that we've resourced very well, that schools open day one, term one in a safe way. We know that kids do better at school. It's where opportunity occurs in life. This is the bastion of providing our young people the best start in life, and education is crucial to that. It is an essential service from the state and the sector. And we know that many kids across the state have had a very disrupted couple of years. In other states, they've had more disruption. But even in New South Wales, to have certain young children to have already missed a quarter of their schooling life is problematic. And we have done everything we can to ensure that schools open day one, term one in a safe way. I'm incredibly confident of the plan and the resourcing of the plan that we've put together over the last 3 weeks. As has been said, there will be challenges along the way. There is no doubt that there'll be times where where kids who have tested positive will need to study and learn from home. We did that successfully last year. We have world-leading work from home plans, and we will keep them going. But we are very confident with the plan that we've had, that we've put in place, and ultimately, compared to other states, we've been able to put these plans together because we've resourced it very well. Other states don't have the access to the rapid antigen tests that we have in New South Wales and in Victoria. We went out early, we procured we've put purchase orders in, for around 150 million rapid antigen tests, and that's allowed us to ensure that as we get kids back in the classroom, we do so in a safe way. And I know that many parents are anxious. Everyone is anxious during a pandemic. What we can do from a state government perspective is plan, resource. That's exactly what we've done, and now we're in the position to open up our schools on the first day in a safe way.
What happens when a teacher or a student tests positive in a class, and the other students in that class, presumably they've spent more than 4 hours with that positive case, are they close contact, or do they go back to school the next day? If the teacher tests positive, are all the kids close contact if they've spent more than 4 hours with them? What happens there?
Yeah. So as I said before, we are moving away from contact tracing and closing schools because of positive cases. If there is a positive case, a teacher or a student does test positive to COVID, either through being picked up with one of those rapid antigen test kits that we've provided or through PCR or other circumstances, they will need to let the school know. Parents will know. You will be told as a parent that there is COVID in your school community, in a similar way to how we provide advice to parents if there's other communicable diseases. For instance, hand, foot and mouth is probably a good example that parents are familiar with. So you will know if there is COVID in your child's school. We will ask you to monitor for symptoms, and of course we will ask you to use the rapid antigen testing kits that have been provided to you. Now this is a change from how we had our school settings last year. It really is about moving our schools in line with community settings, recognising that our schools have a lot of extra measures in place. We have ventilation, we have vaccination of adults, we have cohorting, we have minimal mixing and mingling. So all of that combined gives us the confidence to be able to move to this new approach in our schools for this year. And it's important to minimise the disruption, and this plan, as I said, has been worked on with health and education at the table to ensure that it is COVID safe and COVID smart.
Specifically though, Minister,
We'll go here first and then James.
If a teacher is close contact, they don't have to isolate. What happens if they choose to isolate? What happens then?
Sorry, I don't understand the question.
So a teacher who is a close contact,
through a household setting?
yes,
yeah,
doesn't have to isolate, it can go into the classroom. What happens if they assert their right to stay home
Sure.
and isolate for 7 days?
Yeah, sure. So obviously we will be adding teachers, education and early childhood staff to the public health order for exempt workers. So if they choose to come back to school and do that rapid antigen testing to be able to be there, they can do that, but they don't have to if they choose to stay at home. And, you know, it really will depend on the individual circumstances. Some of our teachers, of course, may be symptomatic. Some might have a member of their household who is a small child that needs looking after and they need to stay at home. So we won't be demanding that teachers who are household contacts but are negative and well to come back. That will be an option that is available to them should they choose to. But we've got a range of other workforce contingency measures in place to deal with any absences for staff because they either themselves have COVID or are a household contact. And obviously individual teachers can make that personal decision for themselves.
Specifically, Minister, in relation to parents of kids in a class where someone in that class, be it a classmate, student or a teacher, tests positive, will the parents know that someone in that class where their kid has spent more than 4 hours in a positive case is positive to COVID, or will they just be told that there is COVID at the school?
Yeah, so parents will be advised in terms of if there is a positive case in their child's cohort, and that's important because obviously what we're seeing, yes, you have children together in the classroom, but for instance, out in the playground you might have, you know, all of kindergarten and year one together, and so you need to make sure that those parents know. So there will be sufficient information that will go out to parents. They will know what has happened in their school, and they will also know that they need to monitor for symptoms and continue to test their children.
But New South Wales Health won't be keeping any record of these positive cases, will they?
No, so when there is a positive case, two things will happen. If you're at home and you do your positive rapid antigen test and your child tests positive, we ask you to do two things. You need to let New South Wales Health know through Service New South Wales, as you would if you recorded a positive rapid antigen test in any other circumstance. So that is what parents and families will need to do. They also need to let the principal know. They need to let their school know that their child will be absent and they are absent because they have contracted COVID. And again, this is what parents do each and every day. If your children are sick, you have to let your school know and the reason why they're at home. That will be the case. So principals will be very well aware of which students are home, who is home because they have tested positive to COVID or they are a household contact, and then we will be able to provide that information out to school communities. So parents don't need to be concerned. You know, as a parent myself, I'm really confident with what we've put in place. Parents will know if there is COVID in their child's school. They will know what they need to do. But the most important thing is we are minimising the disruption. We are not having school closures due to COVID anymore. We are moving much more in line with what we see in community settings. I think that's important. It's important for continuity of education, and it's also important because we've done it in line with New South Wales Health and experts to make sure that we have COVID-safe schools, but also keeping our schools open, which is key.
Ventilation, in ventilation, you said that there's air purifiers that have been sent out. Have you sent out more air purifiers over this Christmas period?
Yeah.
So how many?
Yeah, so we have. So some of you will remember last year we did quite an extensive audit of every single learning space in every single public school in New South Wales. No other state has been able to get to that level of detail when it comes to the ventilation needs of each and every learning space. So school communities and principals have been provided advice specific to their school in terms of how to maximise natural ventilation in every classroom, every library, every learning space. And we have sent out air purifiers for those learning spaces that did need that additional mechanical ventilation. Over the summer break, we've procured more. We've sent more out to school communities, and that will continue between now and the start of school. So we anticipate we'll have about 20,000 air purifiers in schools. They will be used in those areas, as I said, that our audit has identified need that extra ventilation, but we'll also provide them to principals to use in things like staff rooms, common gathering areas, again, just for that little extra layer of support, particularly for our staff.
Minister, what happens after the first 4 weeks? Are we still going to be providing rapid antigen tests for parents? We're not going to take this stop after 4 weeks. And also, who's going to be checking that parents are doing these rapid antigen tests?
Yeah, so in terms of the first part of your question, the plan is to do this for the first 4 weeks of term, and then we will assess the situation. So if we do need to continue this for a further period of time, we'll obviously seek advice from health and other experts in terms of case numbers in the community, how things are progressing. And I'm also really interested to hear from parents and teachers and students in terms of, you know, how they're finding the testing regime. Is it working for them? So the commitment is for the first 4 weeks, and then obviously we'll look at what more we need to do. We have more supplies available. If this is something that we need to continue, we can do that, but we'll assess that a few weeks into term. Sorry, and the second question? Oh, yeah. So obviously we are asking parents to be a part of the solution here when it comes to keeping our schools open. You know, I know that parents by and large are wanting their children to be in school. We've had really good attendance rates towards the end of last year, in fact higher than we saw in 2019. I know our students want to be back, and so I'm really confident that parents and families and students will use these tests as they've been provided for them to do so. We're all part of the solution here, and this is the way that parents and families can play their part to keep their children at school, to keep their children and their friends and the staff members safe, and make sure they use these rapid antigen kits as we're asking them to.
Minister, visitors will be limited to people providing essential curriculum. What is essential curriculum? Does that include like outside providers that come in to do specialist sport classes? Music in particular has been a big issue last year. Will those people, like music teachers and like, be allowed onto campus?
Yes, they will be. So anybody who comes onto site for an educational purpose will still be able to do so. So whether that's providing, you know, sport or music, any of those curriculum activities, that will be allowed. If you're a parent and you're a volunteer who comes in and helps with the canteen or the uniform shop, you might help with a reading group in your child's class. Again, they're all settings we had in place last term. That will continue this term as well. So there will be parents and visitors on site for those essential reasons. But what we will limit are large gatherings on site, you know, big assemblies with a lot of people and parents. We just need to make sure that we're COVID smart in how we operate, and so that's the distinction in terms of who's on site and when. Sorry?
Wind instruments?
Oh, yep.
Will music teachers who teach flute, that kind of thing, be able to teach that now?
Yes. Yeah, so we made some changes in relation to wind instruments and music classes late last year, and those settings remain in place. So obviously we're asking, you know, if they can do it outside in an area like this would obviously be a good idea, but if you need to do it inside in a one-on-one situation for no more than 30 minutes, that is allowed. So again, these are settings that we had in place, particularly for probably the last 2 to 3 weeks of term 4. That will continue for term 1. The other thing I will say is that we will obviously always continue to look at our COVID-safe measures at schools. I think, again, our school communities are used to knowing that when we can ease restrictions, we will. When we can get back to normal, we will. But we've got to get that balance right between making sure that we have a lot of the activities and curriculum parts that are really essential, things like music and sport, as part of what we offer at school. But we've got to get that balance to make sure we do it in a COVID-smart way. That will continue. And, of course, if there's opportunities to ease restrictions, if we find ourselves in a better situation in the not-too-distant future, we'll keep looking at that. We'll keep working with New South Wales Wales Health in terms of our settings.
Have there been any changes to some of those ancillary curriculum aspects, particularly like music, Williamson, or sport, since the very end of last year? Have you changed those settings at all coming into this year?
Yeah, no, look, most of those settings remain the same. I guess the one key change is around things like excursions and overnight camps. At the end of last term, they weren't really something that we encouraged because, you know, we were concerned obviously about making sure the focus was on being back at school and in the classroom, but also some of the risks around those settings. So that's probably the key change that we'll be able to see in term one. Again, you know, and Dr. Newcombe spoke about this, we want to do a risk assessment of those activities. We need to make sure parents are comfortable and give their consent for their child to take a part in one of those activities, but that can include things like, you know, overnight camps, sporting camps, excursions. That's probably the key difference between the end of last term and where we are now for those extra activities.
In terms of the workload as well, obviously teachers are going to be exempt from the close contact, but just we know that you put the call out to require teachers to come back or maybe getting student accreditation. Do you have any figures in terms of how many have actually are coming forward?
Yeah, sure. So in terms of our final year university students and our retired teachers, we already know we have a pool of about 1,000 staff that we can draw on to fill any of those gaps, and I anticipate that those numbers will increase over the coming days in the lead up to return to school. We also have literally hundreds of our departmental staff who they themselves are experienced teachers. You know, many of our staff will be teachers, be principals, and then move on to director roles within our department. They live all over New South Wales. So again, we've got a workforce within our bureaucracy that we know that we can call on should we need to have them back in the classroom. That's also true for a lot of our administrative staff, because as any teacher or principal will tell you, you know, if your school administration staff happen to be out with COVID, they're the ones who really run the school in a lot of ways. So if we need to call on any of our admin department staff to come in and fill any gaps, they're available as well. So we really have a lot of different opportunities and options available for schools, but it will be very localised. It will really depend on, you know, how many staff are impacted, what is the need for that school community. We've got our casual staff, our existing casual pools. We also have many teachers and school staff who are working but maybe in a non-teaching role. So for instance, we might have, you know, a deputy or an assistant principal who's not on a class but can be allocated to a class for a period of time to fill any gaps. So there are literally several layers of contingencies in place ready to go to support schools should they be impacted in terms of COVID and their staff.
Minister, primary students are going to just become eligible for their first dose. A lot of them won't be fully vaccinated by the time they go back to school, but masks aren't mandatory for students in primary settings. Why?
Look, we've decided to keep that setting in place, which again is what we've had throughout last year. You know, obviously it is encouraging that that vaccine is available, and I think we're sitting at over 25% of eligible 5 to 11-year-olds have got that first dose already, which is great, and I'm sure those numbers will continue to grow as we've seen with other age cohorts. But in terms of mask wearing for primary students, we've recommended it, but we also recognise the practicalities of it. You know, anyone who has young children, it is really hard to make them keep a mask on all day, every day. We think that they'll spend a lot of time fiddling and playing with the mask, and then we sort of question the effectiveness of that. So we've left the settings where we think are appropriate and also where we think is practical in terms of what schools can manage and what our students can also manage themselves.
Minister, in terms of parents who remain anxious and want to keep their children at home, there could be 10, 20, 30% of children at home. How do you deal with that?
Yeah. Well, obviously, I think today's announcement, and particularly the specifics around things like rapid antigen tests, I hope will give parents comfort and confidence in terms of what we have available in our school communities to keep their children safe. You know, as I've said, I'm a parent too. I have every faith in what we're doing at our local public school to keep her safe, and I really can't give any better endorsement than that. You know, I feel very comfortable sending my child to school, and I hope other parents feel the same. Interestingly, what we have seen in terms of our attendance rates is that we have had attendance on par with previous years towards the end of last term. So to me, that indicates that by and large parents are happy to have their children back at school. They appreciate and understand the measures that we have in place. But if any parent does have any concern, you know, please talk to your school, talk to your principal, get a good understanding of what the measures are in place in your particular school community, use the rapid antigen tests that will be provided to you, and obviously we expect to see our attendance rates continue to be high in line with where we were at the end of last year as well.
What will be in place for cases, and Premier, are you aware of
delays in enrolment for TAFE students coming into this year?
Yeah.
Yeah.
Yeah. I might.
Delays in course enrolment?
I might ask the Secretary to make some comments in relation to TAFE.
Thank you. So obviously TAFE New South Wales term starts a bit later than the school term, and so their focus at the moment is on their contingency planning and their plans for operation for the start of the year. We are in conversations with TAFE about the supplies that they need to support their workforce in particular, and there'll be more information on that coming, and I'm certainly happy to come back to you on any details around delay. We haven't heard anything on that at this stage. Not in courses starting. What we do expect is that some digital courses may start sooner and that some of the face-to-face elements may be back-ended to the second half of term. But as I said, TAFE New South Wales are working through those contingency plans at the moment, and further advice will follow closer to their term starting.
Premier. Just quickly, just on Australia Day, a few local councils have cancelled a lot of their Australia Day events because of COVID.
Yeah.
Are you anticipating any changes to the government-run events for that day?
We've already made some changes leading into this in relation to Australia Day and moderated some of those events to suit the circumstances. But there will obviously be a range of Australia Day events across the country, and particularly in New South Wales. And what's pleasing in terms of celebrating Australia Day, that many people have taken to organising events in a COVID-safe way, moving the indoors to the outdoors, and I think we're seeing that across the board. We've modified some of the events that we're running here in New South Wales, but ultimately it's a great day for our nation to come together and celebrate everything that's great about Australia.
Are you looking at keeping the current restrictions that are in place across the state beyond January 27?
But we haven't made a decision from a government perspective yet in relation to that, but ultimately my focus is to get kids back in the classroom safely on day one, term one. We want it to be safe for families, for teachers and for parents. So that's the guiding focus of the government at the moment. Now, we've had to make sacrifices over the last 2 years during COVID. The measures we have in place today are proportionate and measured for the circumstance we find ourselves in. As Dr. Chant has said, we would expect as kids return to the classroom, as mobility increases, that case numbers will increase too. So we're certainly focused, as we always have, on keeping people safe, but at the same time keeping society open. Getting kids back day one, term one is incredibly important for their educational outcomes, and that's our focus. And we don't want to do anything that impedes that. So that's our focus going forward. The government will consider that early this week, obviously prior to the date on the 27th.
But Premier, you've done that now. You've done that now, getting kids back to school day one, term one. This is the plan. What's the next focus for you going forward? Is it something like business support, people that struggle? Well,
I know the Treasurer's working very closely on business support, and we've done that over the last 2 years. And we've always said we're going to put people and workers and businesses before the budget. We were able to do that because of our strong financial position here in our state. We provided more financial support than any jurisdiction in the country.
Are the Feds going to come on board? Okay.
Well, that's a matter for them. But ultimately, as leaders in New South Wales, I'm focused on our businesses. I'm focused on our workers. I thought it was incredibly pleasing going into Omicron. Those job numbers that came out recently, the unemployment rate in New South Wales at 4%. If we take a step back and look at New South Wales compared to the rest of the world, in terms of hospitalisations, ICUs and deaths, in terms of economic and jobs growth here in our state, we've been incredibly successful in the middle of a 100-year pandemic, and our focus will continue to be looking after our people, keeping them safe. There will be challenges that come with the school term. By going down this path, there will be challenges that come our way, but it's the right path to take. It's the right decision to get kids back in the classroom on the first day, and we've done everything we can to do so in a safe way. As Minister Mitchell has said, we're both parents. We both want to make sure that our kids are able to return in the classroom in a safe way, not just for our children and parents, but also for our teachers. And I particularly want to thank our teachers right across New South Wales. I want to thank, as Sarah said, and went to Eddie and Ashley's question in relation to, obviously at points in time some teachers may need to isolate, but the volunteers that came forward, the retired teachers that came forward to put their hands up to help, that to have many young students in their final year of university saying, I want to help you, I want to be part of it. That's the great spirit that's helped us get schools back open on the first day. So right across right across the board, people have made incredible efforts to ensure we can do this in a safe way. The plans that we put in place over the last 3 weeks, the work between Education, Health and Department of Premier and Cabinet, it has been a significant operation here, a large scale, as the Minister said. It's been a military operation. I was out at Chullora yesterday at the warehouse. We had with Georgina Harrison, and it was fantastic to see. We had department members of the department volunteering their time to pack rapid antigen tests, to get it all organised, to get the air purifiers out there, the kids' masks, the adult masks. This has been a massive operation. We planned for it, we prepared for it, and now we're ready to go to open schools day one, term one. There's nothing more important we can do than invest in our children, and them being in the classroom ensures their opportunity for future, going forward. Yeah.
Restrictions not lifting on January 27. That's going to have a huge effect on the hospitality industry. What are your plans there? Are we likely to see any lifting of restrictions anytime soon?
Well, I mean, in terms of the restrictions that are currently in place that impact hospitality, obviously the main issues are the 2 square metre rule and face masks inside. Now, I don't think they're substantive impediments. We've worked very closely with the hospitality industry, not just over the last month, but over the last 2 years. The best thing we can do is continue to instil confidence. And I'll work with the hospitality industry. I know that they've asked, for example, for exemptions in critical workers. I've spoken to them in relation to that because I don't believe that's the right approach to be taken for the hospitality industry at this point in time. We want to instil confidence in the community, and I believe that confidence is coming back. But yeah, if you're looking at this, all comes down to priorities. It comes down to priorities, and to be in a situation where you may have to wear a mask indoors, or there might be some slight density restrictions in place in hospitality. What's more important is getting kids back in the classroom, and we've got to make in government those decisions in relation to priorities, and we'll do that as we head into the 27th of January. But what business, whether it's hospitality or any other, can be assured of is that we've got their back. We've had their back during the entire pandemic, and the facts and the numbers speak for themselves. Keeping people in work, keeping businesses open. It's been a challenging 2 years for everyone, but we've always provided that support where it's needed, and we'll continue to do that. That approach doesn't change, and we don't know what's going to come our way in 2022 or 2023 or beyond. But what we can continue to do is make sure we work with industry right across the board to keep people in work and keep businesses open, and that's what we'll do.
Premier, they're looking at doing something like extending the expiry for Dine and Discover vouchers, given what seems to be an underspend of the COVID relief fund. Yep. What are the plans for the money that hasn't been allocated?
Well, the good news in relation to that, I mean, as a former treasurer, when we set up these packages, what we do is we provision an amount to ensure that the funding is there for those who need it. It's not necessarily a bad thing that there's an underspend. That's a good thing, because that means that certain businesses hadn't needed the support. In the economic recovery work we did last year, we provided support for those businesses in circumstances where there may have been a lockdown, and we were going to provide support for any goods that may have needed to be and perishable items that might needed to have been thrown out. So we didn't need to use that, and that's a good thing, because we've kept going through this pandemic. But that does provide capacity to continue to provide ongoing support. But what's important when you're looking at providing that support is that you target those areas and those businesses that need it. Now, that means that sometimes it may take longer, but that's okay. And sometimes it's best to wait and then to invest. And, I saw the Leader of the Opposition out yesterday saying, oh, get that money out the door now, get money out the door now. Well, I've lived this as the previous Treasurer for 2 years. And the approach that we've taken over the last 2 years is definitely the right approach. And that's not, I understand there's concern in the business community is to wait, is to assess, and then to invest. That's been successful over the last 2 years, and that will be successful over the next 12 months as we move through it. We've already seen, even from a federal government level, criticism about the federal government programs in terms of businesses getting support that didn't need it. It's not my money, it's your money. It's the taxpayers of the people of New South Wales, and it's our job as a government to ensure that that money goes into places that need it.
Should the Feds have done more to claw back some of that job? Should the Feds have done more to claw back some of that JobKeeper money that went to businesses that didn't need it? You just mentioned it as source of criticism.
No, I'm not trying. I'm not criticising them. It's hard in a pandemic. We made decisions early on in the pandemic where we went and bought thousands and thousands of ventilators that we haven't used. We went out and bought a whole lot of PPE that we didn't use. We went and purchased 150 million rapid antigen tests. We've gone above and beyond. And we do that because it's better to have more than less. It's better to be able to be in a position where if the need arises, we're resourced and ready to go. When when a TJ approval came through for a lot of rapid antigen tests following the Omicron outbreak, we were in a position with Victoria who went straight out and said, let's go, let's not wait, let's go and purchase all of these tests in a diversified way right across the board. That's put us in a position with Victoria, unlike any other jurisdiction in the country, that's able to provide these tests for parents, children and teachers as we open up school. That should give complete comfort to parents right across the board that we've done everything we can to ensure we open up our schools safely. We have other schools opening right across the country that don't have the provisions in place that you'll see in New South Wales and Victoria. That's a very pleasing thing. And because we prepared, because we went out and purchased all of those tests, we're in the position that we find ourselves in now. So, no, it's not to be critical, James. It's much better that in circumstance, at various points in time, that you overinvest, but at the same time, we've now learned a lot over the last 2 years when it comes to business support. And I think following the approach that we've taken over the last 2 years, we'll continue that over the next period of time and ensure that's success to us is keeping people safe, keeping people in work, and keeping businesses open. That's those three areas. If we do that and continue that as we've done over the last 2 years and continue that going forward, we'd be very successful. And the crucial aspect to that, and the key factor in our success here in our state has been our people. They're going out and getting vaccinated at record amounts, getting boosted at record levels. We were thinking we would probably get to around 70%. That was back in the national plan, 70%, and then opening up. Here we are in New South Wales at 95%. But my key message today is please go and get your booster shot. There's capacity in our clinics. That's been our key in keeping people safe over the last 2 years, and boosters are key in keeping people safe over the next 12 months. Well, I'm not. We always said with Tahi that it was in line with the approach that was taken in other states in Queensland and Victoria. Labor ran a scare campaign in relation to this. The Auditor General has just signed off. Now, whenever you're going through structural changes, the Auditor General looks at those issues, as would have occurred in Victoria and Queensland. What was happening in New South Wales over the last 5 years was not unique. In fact, it predates 5 years. It goes back like 8 or 9 years, when we set out in all the budget papers, year after year, how we'd classify the transport assets for our state. And as we said, the approach we were taking in New South Wales in relation to the classification of those assets, in the setting up of the transport asset holding entity, was completely in line and very similar to the approach that had been taken in Queensland and Victoria. So I completely expected that the Auditor General would sign off, just as the Auditor General was signed off in relation to Queensland and Victoria state transport assets.
Sorry, can I just ask Dr. Chant a couple of questions? Hospitalisations are down, ICU numbers are down, but the number of people being ventilated seems to be increasing. What's happening there? Are the sickers not getting better? What's happening?
There's probably two types of people that come into ICU. So there's a group that just need short-term enhanced oxygen support, be that through non-invasive methods like high flow or what we call CPAP. But then there's some that require ventilation. And of those that are ventilated, some require ventilation for a few days, but others can require ventilation for quite a long period of time. And so we often see that tail The story of the ventilated population is that twofold, and we accrue those ones that require that ventilation for a longer period. They may be ventilated for weeks and even into months. And so that number is probably reflecting those two factors, and that's why it's pleasing to see, as you point out, that the ICU overall has gone down, but that ventilation number may be a bit more stubborn in turning around.
And how concerned are you if there is a bit of a surge in cases throughout, when schools do open, that some of those kids end up in hospital? How concerned are you that we will see an increase in the number of children in hospitals?
Look, I think that we need to indicate that what Professor McInerney said, we don't want to be over-reassuring, but the experience with COVID is that generally it's a mild condition. It's not to say that we want children to be exposed, we want children to be afforded the opportunity for vaccination, but we are creating school environments as safe as we can. And my other message would be, one of the concerns we've got really is around children getting infected because of the combined social networks and taking it home to families. So to me, making sure that anyone that's going to interact with your family is vaccinated and boosted. And so my message is not only to the children, but really the households of those children, the extended family. Please, with some urgency, go out and get vaccinated. The vaccine takes about 10 to 14 days to optimise your protection. Have some sense of urgency.
But if there is circulation, if there is increased circulation, they could end up in hospitals with their children or adults. How concerned are you about how the system will cope?
The paediatric system has not been put under stress in relation to COVID. I mean, Professor Macartney can probably talk about that and reflect on the experience.
Look, I think. Thank you. Dr. Chant's absolutely right. I mean, we've got relatively low numbers of children in hospital at the moment, and most of those children, are going home within a short time period. It's in respect of ICU admissions. They're predominantly children with underlying risk factors, including obesity, could I mention. So obesity in children is a significant risk factor. So it just speaks back to the point that we want children vaccinated as much as we can. 25% is good for first dose, but we'd like many more children vaccinated in the coming days and weeks with that first dose, and then, of course, the second dose. But I think, as you see reflected in the numbers, whilst we've got a lot of infections in children now, it's the adults that continue to be in hospitals and adults with risk factors. So simultaneously with the children program, the criticality of boosting adults is really, really important. It's safe, it's so effective. The interval's now 3 months. So for the whole community to get boosted as quickly as they can with the capacity that we've heard, will really assist in keeping people out of hospital and keeping people well.
How many cases do you think, Dr. Chant, do you think is predicted to come out of schools going back? Like, how many cases does the modelling suggest we're going to have in schools and in classrooms? Is there predictions that you can share with us?
Well, I think that we have seen an increase. If we look at last year, we did see a little bit of an increase in children's identification of COVID after schools went back. That reflects two things. One is the vigilance of parents when they're sending children back and more likely to engage in getting tested. But we are expecting an uptick in cases. But to some extent it is about how quickly we can boost, because the issue with the children is the children will mix with the children, but it connects social networks that perhaps haven't been mingling during the school holidays. But if those households of those children in schools are vaccinated, then it really suppresses transmission. So I can't emphasise enough boosters, and boosters for the extended family, the other carers that are involved in caring for the children. And also just as we move back, parents can take some practical steps to, certainly have play dates outside of school, but certainly have them in outdoor environments. Limit the intense mixing of children outside the school environment will actually afford protection in the school environment as well.
Thinking more specifics on that. Sorry? In terms of thousands of cases in the first 4 weeks?
It really depends on how people respond to the public health measures and where we are on the curve.
Thank you.